now.
Okay.
It says preparing to go live. I'm clicking go live. We should be live now.
Okay.
All right, we are live. So it's 2 o'clock, Tracy.
All right. Welcome everyone today to the Lake Cumberland District Health Department COVID-19 update. We have some members of the executive team that's going to be sharing, that will be answering questions that you all have shared with us over the past week. We have Laura Woodrum who is our Director of Nursing, and Sean Crabtree, who is our Executive Director, and Dr. Wayman, who is our Medical Director, and she'll be joining us here in just a second. You all are watching us YouTube live, but I do want to encourage you all to ask questions. There's a chat box on YouTube live. So if you'll just type your questions in, we will answer those as we walk through the meeting today. I'm going to turn it over to you, Sean, if you want to give some updates about COVID-19 from over the past week.
All right. Let me find my file here. All right, thanks to everyone for joining in. I see a few people are watching live. Maybe a few more will join in a few minutes. Right now, we have had 136 total cumulative confirmed cases in our district so far through yesterday. Of those 136 cases, we have released 60 of those from isolation, meaning they've been symptom-free long enough. They're no longer having to be monitored, and they've been released to go back to their normal life. We still have 68 active cases that we're still monitoring. 17 of those are in the hospital. 51 of those are on home isolation, or if they're in a nursing home, they may be isolated there at the nursing home or the long-term care facility. Of our 68 active cases, there's probably 50 or so that are actually in long-term care facilities, nursing homes, or personal care homes. So as far as positive cases that we're still following that are outside the long-term care facilities, it's a smaller number right now, about 18 to 20. So as far as general introductions into where we are, I was thinking today about how our role has evolved over the last 5 or 6 weeks. Ever since the beginning, we have been doing case and contact investigations. When we get a lab confirmed case, we reach out to that case and ask them questions. We find out who their close contacts are. We reach out to those close contacts and we see how much risk those close contacts were of contracting COVID-19. And if we feel like they were high risk, we would quarantine them. So we have been and are still doing that. As the weeks evolved, we have all along been reinforcing the general message to the public about social distancing, making sure that you're staying 6 feet away from others, avoiding crowds. If you have to go out to get something, making sure you get it and get back home. Staying home if you're sick from work, staying home from work if you're sick, washing your hands correctly and often, coughing into your elbow or coughing into a handkerchief. Those kinds of things. We've been doing that all along because we still believe that's the best way to keep as many people safe as possible. Our role did evolve though as we became more enforcement officers of the governor's orders, the orders he gave to businesses about being closed or those that remained open, that they were able to observe the social distancing and things while they were open. So we evolved into that role fairly substantially. In the last couple of weeks, we've evolved into the role of being consultants for long-term care facilities, personal care homes, nursing homes, and the like, trying to make sure they had really good prevention plans in place and making sure if they had a case, they had good response plans, or if they haven't had a case yet, that they are thinking about how they're going to respond, where they're going to separate the positive cases from those that are not? Do they have enough PPE? Does their staff know how to use the PPE, the personal protective equipment? Do they know how to use it correctly? Do they know how to conserve it and not burn through it too quickly since there's a shortage? So we've been doing a lot of work with the long-term care facilities on getting those plans in place. I suspect over the next few weeks, once we get to the point where the governor is ready to start reopening things in phases, that we will have to see what the governor's orders are and interpret those and enforce those. So our role will evolve in that regard. I suspect as we roll things up, there will probably be some more confirmed cases. So we'll have to more aggressively get into contact and case investigations as we see more positive cases in our district. And we continue to do planning for mass testing. Should there ever be an abundance of test kits available, we're making plans to be able to accommodate that. So that's what we're doing right now. So I will stop there as far as my introductory comments, and we'll go into the questions, Tracy.
All right, thank you, Sean. So you have been talking about long-term care, and we have several cases there. The first question is going to be regarding long-term care facilities. And it is, there has been a lot of question or a lot of attention given to nursing homes. So what steps are being taken to contain the spread of COVID-19 in our nursing homes?
Okay.
Laura, I think that's for you. And you're muted, so if you don't care to unmute.
Okay, I think I got that now. There's been, we as the health department have reached out to all long-term care facilities. We've had multiple calls with them, and we've worked with them individually and provided them guidance and support. We've specifically addressed how they need to check staff temperatures, how they would do arrange their break areas, exclude visitors, which they've been doing that for several weeks now, and supported them with PPE and advised them on that. All of the guidance we've provided them is through CDC guidance and then specific to each long-term care facility.
Thank you, Laura.
If I could add one thing, there was part of the question was about which nursing homes or personal care homes specifically have had cases. We leave that up to the personal care home or the nursing home to work with the county judge about press releases for their facilities. One thing to make note is anytime there's a case inside a facility, the facility does contact all of the family members of those that are in the facility to make sure that loved ones and guardians and those that might be impacted are made aware. So that does happen.
Thank you, Sean, for answering that question. The next question is going to be focused on the testing that's occurring here in Pulaski County now, the mass testing. And it asks about, do you foresee a future expansion of the program? And also, do you expect to see the number of confirmed cases rise due to the increased number of tests being taken or being done? Is that you, Laura? I think you're muted again.
Yes, I do think it'll be expanded as more tests are available, especially when we leave the lockdown situation, and we will need to monitor more closely people who might be infected and asymptomatic, so we can maybe isolate and quarantine. So I think that will happen more as time goes on. And yes, I do think we will have more positives. The more you test, the more likely you're going to find positives. In some of the studies that have been done, up to 25 to 50% of those who tested positive were asymptomatic. So if you look, you shall find.
Okay, thank you, Dr. Wayman. The next question is regarding nursing homes again. Let's see here. With the increased number of positive cases in nursing homes, is there a plan to require testing at all facilities? And if not, at what point are all residents and employees tested?
There are no CDC guidelines as to, and that includes for nursing homes. Each nursing home decides whether they want to do mass testing or not, or whether they just want to test symptomatic people. If you test everybody, you will get asymptomatic positives and you will also get negative folks. That's just a result in one point in time. That means today they are either positive or negative, and you can do something with the positives. You can perhaps put them in a COVID wing. However, the negatives, you're going to have to retest every few days because today they're negative, but they may not be negative tomorrow or the next day. So it opens up a big can of worms, and there isn't anything out there to say this is the best strategy to do one or the other. Currently, everybody in nursing homes, all the staff are wearing face masks and gloves, whether they have a case or whether they don't have a case, just to try and prevent the spread. However, we are seeing spread in spite of all that in nursing homes because it's a closed environment and a close environment.
Okay,
That's my.
thank you. Thank you, Dr. Wayman. The next question, I think this is probably going to be you, Sean. The governor's Healthy at Home or Healthy at Work plan calls for businesses to have ample PPE. We are all having difficulty getting antibacterial wipes and hand sanitizer because everything is going to the first responders. Do the first responders now have ample supply? And will these products be available or open for businesses to purchase in the near future?
Well, there's still, in general, there's still a shortage of PPE and sanitation materials. It's becoming a little bit more available as time goes on, as businesses ramp up production. But of course, there was such a backlog of need in the long-term care facilities, hospitals, and so forth. There's still some shortage. So we are hopeful, and we are watching the market just like everyone else, hoping that material will, PPE, personal protective equipment, sanitizing materials will become more available. But right now, we're watching like everyone else. And, I know there's a lot of people across the state and across the country trying to ramp up production of personal protective equipment, sanitizing materials, testing materials, and so forth. So I don't know if anyone has any specific answer better than that, other than there is generally still a shortage, and we are still watching for the market to open up and generate some more of that.
Tracy, this is Amy. I just want to add to Sean's answer that I would encourage businesses who are planning to reopen and looking ahead to those days where that's coming and trying to get their plans in place to go ahead and place the orders that they need the items with their vendors, and reach out to the vendors they traditionally use, and also look at vendors who maybe they haven't used before and get those relationships built and go ahead and place orders, because you never know when one's going to be filled. We've ordered things through the health department, that we didn't necessarily think were going to be filled, that were back ordered for months. And then, it does come in. So go ahead and get your things ordered so that you can be in line for when they are available.
That's good advice. It's
Thank you.
always better to be proactive if you can be, and try to get things ahead. And that would be the same thing I would recommend to businesses or personal care homes or whatever. Look ahead and pre-plan as much of the response as you can.
Thank you, Sean. Thank you, Amy. There was a comment that was sent in to us, and I'm not sure, so you all can, whoever wants to jump in and answer this question, please do. But the comment asked about COVID-19 patients and being treated at particular health department or health centers. Do we know if those are treated at any health center across our district?
if you're
Is it
saying,
limited?
are there cases being treated in area hospitals? Yes, there, several area hospitals are treating positive COVID patients, and some are still in the hospital, some recover and get out of the hospital. But yes, there's many or most of the hospitals in our area have had one or more positive COVID cases that they've treated since this began.
Okay. All right. Thank you,
If
Sean.
if there's any reporters or anyone in the public who's watching in wants to type a question in the YouTube live chat box, we'll try to answer it if we can. While I'm waiting for that to happen, I can say, it looks like some of the neighboring states like Tennessee are going to be opening things back up probably quicker than Kentucky. So we will all have a watchful eye on what happens in Tennessee. We really don't know right now how many people have had COVID-19 that have been asymptomatic or so mildly symptomatic that they never got tested. If that is a significant amount of the population, when Tennessee opens back up, they may not have too big of a spike in new cases. But if the social distancing and things has been working, and there's a lot of people who've not had it, it'll start spreading again, and they will have a spike. And certainly, if their hospitals and things get overwhelmed in Tennessee, then us in Kentucky will know that's not the right approach. So we'll all be watching curiously at what happens in Tennessee as they open things back up. Whether, and that'll help us to know how quickly we need to, as a state, I think, roll things back up. So I'm watching for questions live. I don't see any. Do you have any other things, Tracy?
I do not have any other things. Amy, do you have any other comments you want to share?
No, I'm sorry. I joined a little bit late, so I'm sorry that I didn't get on the beginning. That has come up already today. The comment that I made about the vendors and going ahead and ordering and things, businesses are looking to ramp up and reopen as soon as possible. And of course, rightfully so. We've been shut down for weeks now, and I understand that's everyone's livelihood. So I encourage businesses to be proactive and start looking ahead and thinking. I think that's our next big thing on the horizon, is to look at how we are going to phase this reopen out across our district and the state as a whole. So if the health department can do anything to assist in that, we certainly will. I just want businesses to go ahead and be proactive and take some steps, in the interim until we're ready for that.
I see someone tapped in. You all are doing a fantastic job. Thank you. I sure appreciate the positive feedback. We get some positive feedback. We get some negative feedback. Everyone has strong opinions about what's going on in the state, about things being closed and what's the right thing to do and how quick should we open and all of that. And I know a lot of people, are negatively impacted financially as they're not working, and there's just a lot of emotion going on. From our perspective in public health, we're trying to comply with the governor's orders, and we're trying to do the best we can to keep as many people healthy as possible locally. And I know there's a lot of strong emotions out there about this whole situation. I, like everyone else, wish that this was behind us, but we've got a little ways before that's going to happen, I think. We've been getting a lot of questions the last few days about things like high school graduations and what types of businesses will be able to get open. I'm hopeful that the governor will give us a little more guidance on some of those issues pretty quickly, because if schools are going to do high school graduations in some non-traditional format other than virtual, we need a little more guidance from the governor's office so we can interpret that and get that information out to the locals. So, I don't know as much about that at the moment. I listen to the governor's presentations every day, and we get information relayed to us every day from the governor's office and the State Department of Public Health that we have to work through so we can give good guidance to our communities. There was a comment about, yes, thank you. I guess that means they think we're doing a good job, so I appreciate that. Anybody else have any comments?
Sean, Amy, you guys may want to share the testing is occurring now at the center and some of the guidelines for that.
There is testing at the Center for Rural Development for anyone in our service area in our 10-county district or any of the counties just outside of our district. They have a capacity, I think, to do 300 tests a day. They did 201 yesterday, so they left about a third of their capacity on the table yesterday. They're got capacity for 300 tests today and 300 tests tomorrow. As far as testing goes, we have a population of 208,000 people in our district, and the total amount of testing that's been done for our district in the last 6 weeks, we've really just scratched the surface of this testing situation. So we really, we're really curious how the testing, when the testing kits will become available, and when all the swabs and the medium and everything that's needed to make that happen. We're just as curious as everyone else when that will be produced and be made available locally, so that we can be a little more proactive in that regard.
Okay, thank you. Amy, do you have anything to add with that?
Just add that today at the testing at the center that's going on with the little clinic through Kroger, they have taken off the appointment required piece. So you do not have to have an appointment before you enter the site. You can register on site now. You still have to be symptomatic. They're still testing only symptomatic people. But if you have even one of the COVID symptoms, they're going ahead and registering you and doing the testing today. Tomorrow is predicted to be bad weather, I think, in the region, and especially at the Pulaski site. Some storms and some rain are forecasted. So they're really pushing today to get as many people as possible through in case tomorrow's bad weather causes any sort of delay or problems with the test site.
Also, any first responders or healthcare workers, I don't think you have to be symptomatic if you're a healthcare worker or first responder, since you've got a whole lot more likely chance you may have been exposed. If you want to go for a test, be a good day to go get that.
Okay. All right. I'm not seeing any questions on YouTube Live. So Stuart, Laura, Dr. Wayman, are there any comments that you all would like to make before we close the meeting? Nope, everyone's good. Sean, do you have some closing remarks that you want to share?
I will just remind everyone of the social distancing, making sure you're staying home if you're sick, covering your cough, washing your hands, staying 6 feet from others. If you have to go out quick and there's going to be a few people around, it's okay to wear the mask as long as you're not touching your face a whole lot when you have the mask on. And just like everyone else, we're watching how the state performs, so we can, we want to see businesses roll back up and people get back out more close to normal. So we're hopeful that happens too, and we'll be watching along with everyone else, the governor's daily updates to see how close we are to that.
All right. Thank you all for joining today, and this concludes the meeting, and we hope to see you all next week at 2 o'clock. Thank you.
Thank you all.